Did Americans finally get all of the answers they deserve? Let's bring in Republican Tennessee Senator Lamar Alexander. He is ranking member of the Senate Health Committee that held its own health care hearing this week. Senator, thanks for being with us.
Thank you.
Okay, so what grabbed your attention this morning from the hearing?
Well, what brought my attention is the difference between the number of people who may be signed up by the end of the month and the number of people whose policies are canceled. Already from the news reports that we've counted, 3 or 4 million people have had their policies canceled by Obamacare, and after January 1, starting January 1, they won't have insurance. And if only 800,000 sign up, which is a number that Marilyn Tavenner gave yesterday in her testimony, that leaves several million Americans without insurance.
It was interesting. Kathleen Sebelius, as far as I could tell, didn't say exact numbers today, though in her prepared statements that were released before she started speaking, she did give some numbers. She said that 700,000 applications have been submitted. That's, of course, different than enrollments, but that 20 million unique visits they've counted to healthcare.gov. Does that prove her point that there's a huge appetite for insurance and healthcare out there?
Well, I imagine there is a huge appetite for insurance and health care, especially among the people who are about to lose it. I mean, think about that. I mean, you've got until December 15 to actually, through this website, find a way to sign up to get insurance that disappears on January 1. In Tennessee, we have 16,000 Tennesseans under a program called R-Tenn. It was outlawed by Obamacare, and we've been getting letters from those folks who are finding on the exchange that their prices go up 400%. They're in real trouble.
So is the answer, Senator, for the administration to somehow make good on the president's promise, if you like your health care and your plan, you can keep it? Should they rewrite this somehow to incorporate those 3.5 million people who are estimated to lose their coverage?
The answer to that question is yes. You can go to the White House website today, and it says, if you like your health plan, you can keep it without any change due to the health care law. That's what it says today on the White House website. So we should pass Senator Ron Johnson's legislation, which would put into law the president's words. If we don't do that, we're likely to get to January 1 and have 4, 5, 6 million Americans who have had their insurance canceled by Obamacare and who have no way to replace it.
Kathleen Sebelius has promised that this will all be fixed by the end of November. If that's true, if the website works well by the end of November, does she keep her job?
I don't think she should. I think there has to be accountable somewhere in the government, and that she should resign. But the bigger problem is the large number of Americans who are going to be terrified as they approach the end of the year and find that their insurance is canceled and the website doesn't work, and they either can't get insurance or they can't afford insurance because the higher premium takes it out of reach.
Absolutely. There can be no lapse in insurance. That would be disastrous. Senator Lamar Alexander, thanks so much for taking the time to talk to us today.
Thank you.